So you've done your FUE hair transplant procedure. Congratulations. Now you might be a little confused about what's going to happen next. What are you expected to do? So I'm going to tell you everything you need to know about post-op care of hair transplant procedure. Hello everyone, I'm Dr. Parsa Mohebi, a hair transplant surgeon in Los Angeles. Today I'm going to tell you everything you need to know about aftercare of FUE hair transplant procedure. What to expect after a FUE hair transplant. The first few days, weeks, and months after hair transplant, you see different changes in the recipient and donor area. On the recipient area, you may see some redness, some scabbing. The new transplanted hair, you see them for the first few days, they might have some crustiness, which are scabs. When you wash them properly, they should be gone, and it should look nice and clean after day 5 and 6. The scabs should fall after day 5 and 6, and you see normal hair and transplanted hair next to them that they will grow for a couple more weeks, and then you lose them. Within the first few weeks, you still may have some pinkish discoloration on the recipient area that gradually will go away. Week after hair transplant, you should not have any scabs. The scabs should be gone. The hair is still there, the transplanted hair, you see them. They will keep growing for the first few weeks after procedure, and then you lose them. The pinkish discoloration is fading gradually. On donor area, you have no visibility of the wounding or anything that should show that you had a hair transplant done, and everything is gradually normalizing on your scalp. So after the first week until the end of the first month, you see the transplanted hair growing. So every single hair that has a hair shaft on it will grow, and then they become a little longer, maybe up to probably like 1 centimeter-ish. Your own hair, if you have existing hair around the transplanted area, they will grow too. So at 2 weeks or 3 weeks, you look pretty decent. You have a new hair growing, you have your existing hair, you look like you just got a buzz cut if you had a shave option, or if you have the celebrity FUE with long hair, you see the transplanted hair with long shaft that adds to the bulk of the hair that you currently have. And then after the first month, you start losing the transplanted hair. So the first 6 months after hair transplant, after you lose the transplanted hair, you go back to exactly where you were before the hair transplant. So there's no irritation, most likely no scarring to be seen on donor or recipient area. So after 1 month, you expect it to go exactly back to normal. Occasionally some people, like less than 10% of them, don't lose the transplanted hair shafts. So they will keep growing from the day of procedure, and we see more and more of those because of simultaneous extraction and placement. So the grafts will not stay out of the body for a long time, so they're less traumatized, so they have more chance of growing right after procedure. Within the first few months, if you have any redness or pinkish discoloration, they will be gone gradually. After the first 2 or 3 months, you pretty much back to normal. You're back to normal washing. The first few days that we discussed, that you have to wash the hair gently and more carefully. After the first week, you're pretty much back to normal. So you use your fingers and nails. There's no problem, no limitation with washing. You have to actually wash it more aggressively than the first few days, because you want to get rid of the hair shafts if they were supposed to fall out. And then within the first few months, you may start seeing the growth of the new hair after month 2 or 3. So at that point, the hairs are fine and tiny and short, and it's not like grass that they all grow at the same time. So they're one here and one there. So people who see on a regular basis, they cannot realize what's going on. So they may come to you and they say, hey, you look different, you look fresh, you look younger, because of the new baby hair that they're growing. So that growth will become better and better. At 4 to 6 months, all of them are grown, but they're still short, and they have to grow 1 centimeter every month to become to the length that you can comb it and style it. That will happen after the 6 months to 8 months period. When can you go back to work after a hair transplant procedure? With FUE hair transplant procedure, the downtime is very minimal. So there is some redness for the first few days. If you can wear a hat, you can go back to work even immediately. In some cases that we do temporal points, we cannot allow patient to use hat. So that will be probably the first 4 days that you cannot touch these temple areas. That will be the time that you probably have to just stay away from people, or if you want to be announcing that you had a hair transplant done, you probably want to avoid going out for the first 5-6 days. When can you go back to your workout routine? That's a very common question that people ask us. So pretty much after a FUE hair transplant, if you know that you're not touching the transplanted area, even after the first day you can start with mild workouts. Sometimes I recommend patients to stay away from everything for 5 days, just because we don't want you to go to a gym or start doing the workout or running and grab a towel and wipe the forehead and hair with it. So to be on the more cautious side, I would like you to not to do any workout for the first 5 days, but after that you can resume pretty much everything. There's no limitation after that. You can be more aggressive, you can wipe your forehead, you can wipe your head, and you don't have to limit yourself with any sort of workout. So is there any scar after a FUE hair transplant? Scars are always there whenever you cut skin, even microscopically. There are going to be scars, but those scars are very minimally visible or non-visible, and they are like on a microscopic level mostly. On recipient area, there's no scarring to be seen. On donor area, also there's no scarring to be seen. There is a small chance of having hypopigmentation on the back that is happening in a small number of patients. If you shave your head and somebody look very close with a magnifying glasses, they may see the spot that hair was removed look a little bit whiter or lighter. Losing your own hair after hair transplant is a not very common situation, but it could happen. It's called shock loss. So people who have existing hair that are in process of hair loss, any stress can make those hairs be gone faster. So that could be trauma, surgery, medical conditions, and hair transplant is one of those conditions. So to minimize the risk of shock loss after hair transplant, we recommend patients to go on finasteride if they are men, or Rogaine if they are women. Those medications can minimize the risk of shock loss after hair transplant. Well, most people lose the transplanted hair after transplant. After the first month of hair transplant, you may lose the hair shafts of transplanted grafts. This happens in probably 80 to 90% of the patients. We see more and more people keep them and keep growing them because of the newest method of hair transplant that we call simultaneous extraction and placement, that minimizes the stress to the grafts and make them not go to sleep after transplantation. But don't count on that. So if you have a hair transplant, be prepared to lose every transplanted hair after the first month. So there are two types of hair loss medications. One is finasteride or Propecia, that men are taking it for male pattern hair loss. One is Rogaine, that's a topical that some men and most women can use after hair transplant. So if you're using finasteride, you don't have to stop it. You're continuously using it and there's no interruption. If you're using Rogaine, the first 5 days after procedure, you cannot put it on because you have, healing wounds and you have some irritation that may get more irritated by putting Rogaine on it. So you have to stop it. You have to use it until the day before procedure and then stop it and then resume it 5 days after hair transplant. Haircut after hair transplant procedure. Obviously, if you choose the shaved option, the hair is very short, you don't have to worry about it. But if your hair is longer, I would say give it a good 1 month for the haircut. If it's normal haircut, it's okay, you can pretty much do it anytime. But if it's shaved head and you want to shave it again, or you want to razor shave it, I don't want any razor shaving for the first month after procedure. Remember, you have a hair follicles that are having a hair shaft in it. Most of those hair shafts are going to fall. So if you shave it, you reduce the opportunity for those hairs to be caught with your hand and fingers to get pulled out. So some of them, they may stay in and they may increase the risk of ingrown hair. So no shaving for the first month after procedure, but normal haircut you pretty much can do anytime after the first week. Scalp after hair transplant. Some people start feeling some itchiness on the recipient area and donor area. Most of it is because of the scabs. When the scabs develop, you may feel itchy. So if you wash them properly the way that we show you, like in our offices in California, we have patients put the shampoo on the recipient and donor area, and that shampoo will be provided. You have to keep it for a couple minutes and then you can rinse it. After 4 or 5 days from the day of procedure, you can leave the shampoo longer. So the scabs are still probably going to be there. So you want to leave shampoo longer for probably 15 minutes or 20 minutes after day 5. And at that point, you don't have to gently or baby wash your scalp. You can be more aggressive with your fingers and nails. Remember, the first 4 days you have to dab them gently. After day 4, you have to wash them more aggressively. By removing the scabs, the itchiness will be gone. Occasionally, if you still have itchiness, it will be very mild. If it's bothering you, you can contact the physician and we will provide medication for itchiness. So pimples after hair transplant is called folliculitis. It could be seen after hair transplant, both in recipient and in donor area. So when you get those, they usually come here and there, 1 or 2 or more. They usually won't affect the growth of graft, so you don't have to worry about them. But if aesthetically they're bothering you or they're painful, you can do hot compress to minimize them or to get rid of them by getting hot water, towel, squeeze it, put it on a couple minutes, repeat this 4 times a day until the pimples are gone. If they're not still gone or they're bothering you or they become painful, you have to see your doctor and we can incise them for you. I hope I was able to answer all of your questions about post-FUE hair transplant care. If you have any other questions or comments, make sure you put them on the comment section. I'll be sure to answer them as soon as we get them.